Let me begin by first congratulating you just for being in this space and in this room. Because by your very choice of career, I think you're making a statement. And that statement is how much you care for society, for India, for humanity at large. Because I know that everyone sitting in this room had options. You had, multiple different options of what you could do with your lives and your career. And the most precious commodity that we all have is our time and our capability. And if you've chosen to devote that to the social impact sector, it's a tremendous thing and it's super exciting. I think in the days when we began at Apollo in 1983, there was no coining like social impact, so otherwise maybe in some quasi way we would have been in that sector, but I will share the story because it is a story very similar to all of you, which is a story of wanting to make a difference, of a struggle which was quite uphill. And as all good stories, it has a fairly happy ending. So I will share that story with you. So actually when my father, Dr. Reddy, came back from the US, he used to work in Mass General. He came back, his father was an agriculturist. And one day after he wrote to him about this tremendous research paper and what he was doing, his father said, great. And then he sent him a picture. In those days we didn't have email, so I guess it went by post. And my grandfather would not write, but he got the village scribe to write a letter back saying, I'm really happy to hear, your mother and I are happy to keep receiving these details from you. But imagine how nice it would be if you could do some of this in India. That's all he wrote. And I think within a month, my parents had packed up 4 daughters who were too young to protest, and we all got packed off to India. And we were at a time when there were no schools who understood NRIs, so we went to Rosary Metric Convent, which it was a fairly tough adjustment. We had to learn Hindi, which was really new, and our accents were funny, and we ate different. And besides the big one thing that Dad did was that he set up a clinic within a hospital. And he began at that point of time to deliver care which was far higher than what was happening in the city. So people from all over came to him. And then he used some beds in the nursing home and kept improving. He bought Chennai's first defib, Chennai's first treadmill, improved the lab, taught nurses, got a nurse from abroad to teach what intensive care meant. So lots of developmental things. But one day, he had saved a young man from a heart attack. He was only 41 years old. And he told him, look, there's no credible heart surgery program in the country. The success rates at that time were 65%. So we lost too many lives. So you go to the US, I'm referring you to Dr. Denton Cooley, who's a good friend of mine. And before that young man could raise the $70,000 required for heart surgery and get his visa, he succumbed to his second heart attack. We lost not just the young man, but his wife, became a widow. He left behind 2 young children. And looking at them that day, Dad said, if Indian doctors can cure and heal people all over the world, why don't we give them the infrastructure to do it in India? And the journey from that powerful thought, which happened, 4 years before we opened, so that I think 5 years, 1978 to 83 when we opened our first hospital, was a series of very difficult steps. Banks would not fund hospitals. He basically, had his own personal income and a little savings. His pride and joy was his Lincoln Continental, his large car, which he sold, and moved to Fiat, which, those cars are no longer on Indian roads, but that was the car that then would drop him in the hospital, come back, drop us in school, and then, go back to him. And then we all came home by bus afterwards because we didn't know what his program would be. But anyway, he continued to practice in the morning, and in the evening he became an entrepreneur. on the garage of a house next to his clinic became our office, and A.F. Ferguson built a business report. And more than the business plan, the viability, the fact that banks wouldn't fund, he went to Delhi over 100 trips to say you need institutional funding for healthcare. He then realized you needed over 75 licenses. The land that he acquired was then taken to court by the neighboring school because the school wanted a playground. He fought and won that case. So a series of battles. But finally in 1983, when Gyani Zail Singh opened or cut the ribbon, somebody standing behind said, you know, this Dr. Reddy is a very smart man, he's calling it a hospital, but in a year this will become a hotel. It was the first time that somebody had built a hospital on that scale. And it was only 170 beds, but, you know, compared to what we're building these days. But in those days, in 83, it looked amazing. The President's program had 17 minutes to inaugurate the hospital. Once he saw what he saw, he spent 1.5 hours with us. The country's first CT. The first time there was a professional cath lab connected to a theater, connected to an ICU. A nurse who came along with the monitoring system from Space Labs to train our nurses. She came for 3 months. She stayed for 1.5 years. She became part of the Apollo family. So there's so many things, you know, so many journeys, so many difficulties. But the only reason I'm sharing this story is because through every single thing, he somehow managed to stay strong and committed and connected to his core purpose, which was to bring healthcare of international standard within the reach of our people. And over the last 36 years, whether it was adding more hospitals, building 18 nursing schools, creating, you know, a clinics organization so that there was a continuum of care, adding pharmacies, which is today, you know, 3,600 pharmacies, creating our social impact project in his village or hometown because he knew there was a better way to deliver medicine. And then the deep work on, you know, organ transplant, the act was passed because of some of the work that he did. The entire aspect of emergency care. In the earlier days, in fact, when I was an intern at Apollo, the youngest resident got the worst posting, which is the emergency room. So the freshest guy in the building gets sent to that place because you don't get to follow a big doctor. All the fancy residents or registrars got to follow big doctors and become their interns because the emergency room had no leadership of a major consultant. So the entire change of how emergency medicine changed in this country, we created a degree in partnership with the Royal College to train emergency medicine. We created the first wireless connected ambulance service and created the paramedic training program. And, you know, thousands and thousands have been trained afterwards. But he simply said, you know, and then you had to go to court. Whichever doctor treated the patient in emergency, if there was a court case, a medical legal case, or a reimbursement for accident, the doctor had to go and stand in court for 5 hours. So everything was a deterrent, and every time his team would say, sir, why do we want to do this? It's so difficult. He would simply ask that if one of your family members had an accident, would you want him to be treated at Apollo or treated in one of the other facilities which exist in the, you know, the other sector? And all arguments rested, and we continued to persist and pursue. And today you see some of the best emergency care. We're saving lives every day. And over the, you know, the past 36 years, we've had the good fortune or the grace to touch over 180 million lives. Thank you. And I started with the cardiac story. Today we've completed over 270,000 open heart surgeries with a success rate of 98.3%. So and then once when we were celebrating the 50,000 open heart surgery, Dr. Girinath stood up, you know, on stage and said, I'm very happy that we're having this, but the point I'm more happy about is of the 140 credible heart surgery programs in this country, 97 of them have people who were trained at Apollo. So it was not just the direct impact, it's the peripheral impact that innovators like all of you have. Because you start something and 20 others will see you and start it as well and do something similar. And one way to look at it is competition, but the other way to look at it, the way Dad does is that that they are also doing the same thing that you wanted to get done, which was help improve the country. And that's why I think the sector you're in is amazing. You're standing at a point in the country where we have an extremely dynamic, far-thinking Prime Minister who is charting out the course for a $5 trillion economy. But at the very same time, whether it's, on multiple indices, whether it's our sustainable development goals, whether it's the fact that we still lose one baby every minute in a manner that shouldn't, the large number of children who sleep hungry every day, the malnutrition which is happening, hundreds and hundreds of issues remain to be addressed across the country. And then there's the very important question that I've raised multiple times, but I believe that all of you are the more appropriate voice for that question. And that is GDP really the ideal barometer of success of a country? And the day we change that to a health-related parameter, to a happiness-related parameter, to a social index development parameter, I think that's the day that we will live up to the ideology of the true India, which was socially very, very evolved, which was, as a humanity, extremely evolved. And we cannot call ourselves evolved or advanced when we have significant issues like these which are untouched. I think WhatsApp is taking over our lives, and much as we don't want to this thing, there's some good stuff which comes out of it. I don't know how many of you saw the New Zealand Prime Minister's statement of what she's done. And she was challenged to say what she's done in under 2 minutes. She took 2 minutes, 36 seconds, but she laid out the entire achievements. And the beauty of it was it focused on children and their nutrition. It focused on mental health. It focused on impacting household violence, on people who go hungry, and on true happiness and development index. So whether it's Bhutan or New Zealand, there are examples across the world that there's a growing awareness that economic development is not the only indice. It is the equality with which we take forward an economy and a country, which I think is truly one of the major factors we should be looking at. And this growing disparity between the haves and the have-nots, the digital divide, how do we take this entire power of digital to be transformative? And I think that's what all of you are doing. They're wonderful examples. I'm not really going to, talk too much about that, because I think you're probably better experts on that subject than me. And I know that Donate Cart spoke about what they're doing, and Bharat Roshan, again, very interesting. Lots of very beautiful examples have already been brought forward in front of you. So I will not share that. I'm going to quickly, try and look at the 3 or 4 areas where we can either ideate together, share some thought process, or partner in some of your success. I think there are 3 or 4 large companies which are currently in the mid-segment, which have had their clinical validation in Apollo, and I will address, how many of you are working in the health sector? Health, nutrition, water, women. Okay, so about 40% of your audience, at least 35%. Thank you. So lots of my health things will be relevant. So very quickly, I'm going to start with, I think, what is the most, this thing is that in the year 2000, we launched our whole journey into telemedicine, and we were lucky that Bill Clinton, when he was visiting, actually pressed the button which connected our village, Aragonda, and you're going to hear more about Aragonda later, but connected Aragonda with a hospital in Hyderabad. This was the year 2000. I was in Aragonda at that time. When we started working on the project, we were connecting them to Chennai. But when they said, okay, Bill Clinton will press this button, to do telemedicine in those days, we put together the bandwidth which we got from 3 phone lines. We connected that, created adequate bandwidth to do image transmission. And then, audio and video is easier than live image transmission because the pixels, your loss in transmission, all these issues. But anyway, we put together 3 lines. We were able to start creating a viable telemedicine program in a small rural hospital which had a population of only 7,000 people. And when this doctor did an echocardiogram on a child, a young girl, and diagnosed a hole in the heart, Clinton saw this and he said, I wish technologies like this and initiatives like this could go all over the world, because the benefits of high-tech medicine can go to people everywhere and not just people who live in cities. From that day's journey in 2000, today, 19 years later, we have over 75,000 telemedicine connections. We've moved from the fixed line connection to ubiquitous access over the phone, so you can just dial into Ask Apollo or download the app and do a teleconsult. We do connectivity with the government, so in over 60,000 common service centers, CSCs in rural areas, you can get access to a doctor's second opinion. We are at the highest point in Himachal, and we do a tele-emergency service. We do tele-ICU service to nursing homes in remote areas because they don't have critical care doctors. Now we're looking at integrating devices. We've already done 3 and built a device integration platform. So everyone in the audience who's looking at devices, our remote care division has actually done clinical validation of over 300 devices, chosen a few partners, is looking for more partners. Our intent is to move as healthcare consumers are moving, and they are moving from the hospital to clinics, from clinics to home, and from home to a 24/7 ubiquitous access to care. And it's in that environment which you juxtaposition with the growing burden of non-communicable disease, which is a lifestyle-related disorder. And healthcare as we know it now, for about 30 to 40% of treatments, is going to shift outside of the hospital. And that's where the device and other players have a very interesting role to play to partner into a new knowledge environment of ubiquitous access. The partnership offered there is really not only we have a small fund, but we also have what I think is more important, which is the clinical validation team who mentors device companies through what works, what doesn't work. Moving on, I want to share the story of Aragonda, and the reason I'm sharing this is that it goes beyond healthcare. So this first place where we did the small hospital, this was in the year 2000, we also created a 1 rupee a day health passport. And in Telugu, the little messages went out on wall writings, because that is one of the most cost-effective ways to communicate in rural India. And so it said, for the cost of your BD packet, will you spend 1 rupee a day for healthcare for the whole year? And actually 75% of the village said yes. And the remaining 25, we actually used the foundation to pay for them for the first year only, so that the whole village had access to the hospital for free. And that was a fairly transformative move. I think it was actually the first birth of universal healthcare in this country. And this went on to, they continue to pay, but we took that data and we actually did the Arogya Bhadrata, which is the police coverage. We then went on to do Yashashwini in Karnataka, and we ran that program for almost 12 years at the back end to ensure no fraudulent claims, appropriate care for the appropriate person. That then became the basis for RSBY, and now, it's a tremendous thing that our government has announced Ayushman Bharat, because Arogya Shri in Andhra and Telangana was one of the early ones where Chief Minister then Rajshekar Reddy said, yes, we must cover the whole country. And now that we say that the whole country will be covered, that he said cover the whole state, sorry, but the whole country will be covered, the power of Ayushman Bharat is that when an insurance moves in or a third-party payer moves in, it becomes the engine which can fund the development of the healthcare. Otherwise, people who can't afford it, only the affordable pay. So that whole index. So the market has now kind of opened up to say that potentially in a year or two, 1 billion people in India will have access to healthcare. But they'll have access not just in the large hospital format, but in all kinds of new and evolving formats. And that's where I think social entrepreneurship has a role to play. But the bigger role to play is what we're doing in Aragonda, which is to actually say, go beyond the treating of disease and bring down the burden of disease. And to do that, you first address social determinants of health, clean drinking water. So we created, the RO plants, the panchayat runs the jelly cans, everybody buys their water can for 7 rupees and you have clean drinking water. Gastrointestinal disorders drop significantly. Every household in that village, when we started at 7,000, every household had a toilet. So sanitation was 100%. We then moved to nutrition, and while we couldn't do nutrition for everyone, we opened 11 nutrition centers, so all vulnerable population, children below the school-going age and pregnant mothers, came to the nutrition center to eat lunch and also be given a banana, a groundnut ball, and a protein packet. So this changed the profile, and while they were there, we counseled them on tetanus shots and institutional deliveries. I'm very, very happy to say that Tavanampalli district, Aragonda village, has the lowest maternal and infant mortality in the country. And that is a model if somehow we could replicate, whether you work with the government, whether you work parallel, because the primary healthcare centers were saying, why are you doing this? We said, no problem, we'll sit in your center and do it, but let's do it together. It doesn't matter. Because I think everybody talks about PPP. The first thing we have to do is remove in healthcare sector this artificial divide between public and private. Because the consumer knows how to go between each one of these very smartly. It's only in our minds or our heads or, in the heads of some people that this divide exists. We must say that we are a health sector. And there is a cost to health sector and someone has to reimburse it, and public needs to be able to access it, creating a continuum of care with an appropriate data flow. And once you get into the data flow, then there are 100 other ideas, whether it's artificial intelligence or what you can do with that data, which become the next step of what I'm sure all of you are working on in terms of, or some of you are working on. But coming back to Aragonda, after we did the social determinants of health, we did the nutrition centers, we then focused on NCDs. So we looked at diabetes, blood pressure, and early cancer screening. We also did care for the elderly, the cataract surgeries, the calcium supplementation. But we found in this population of 68,000 people that there are currently now 6,000 people with either diabetes or blood pressure that need monitoring or care. We're now having, Harvard is doing a case study, and we're having Public Health Foundation do an impact study, because our belief is that post the appropriate management of diabetes and hypertension, the burden of cardiac disease has also come down. The number of strokes has definitely come down. And this is the way that the future of healthcare will be: proactive, preventive, personalized, at your doorstep. And this is what opens up the scope for 1 million entrepreneurs to really work, because Ayushman Bharat on one side, technology on the other, a large dispersed population, and a growing burden of lifestyle-related disorders. All these connect very nicely into a new evolving ecosystem, which we're very, very happy to invite any of you to come into Aragonda. We've now moved the program to the next level. We have a large, nice community center, as well as 20 rooms that anybody is free to come and stay in. We've begun women's empowerment programs, so 10% of all the scrub suit in Apollo Hospital are stitched by the women in that village. They now earn about 8,000 to 12,000 rupees by doing this work. And our goal is to take this up to 15,000, save 3,000 a month from into their savings account, so that in a year they will have about 36,000 rupees and be able to put their down payment on beginning to build their own houses. So there is integrated social impact development happening in Aragonda, and I'm sure there are 100 other things to be done. So anyone who's interested to use that as your hub or your showcase for innovation, or as your test bed or your sandbox for innovation, this is truly an open invitation. We have a fairly nice team over there, and I'm very, very happy to host any one of you to do that. I think I will close, and if there's time we can field some questions.